Alright, so it's Tuesday, we're back at the Infusion Center, and today Harper's going to receive 4 different types of medications, so let's talk about what they are and why she's getting them. The first medication is a iron infusion, and that is because she has iron deficiency anemia that's pretty common in patients with nephrotic syndrome, so every other week she receives an iron infusion, which lasts between like 1.5 to 2 hours. The second medication she's receiving today is called albumin, and this is to replace the protein that her body is leaking through her urine, and this is something that she has to receive every week. The third medication is called Lasix. Some of you may have heard of this before as like a water pill, and sometimes you can take it as an oral pill, but for some reason Harper's body just doesn't seem to react well to the pill form, so she gets it in an IV every Tuesday, and that helps flush out all of the extra liquid and water that her body wants to retain. Fourth and final medication she's going to receive today is called Aranesp, and that is because her body is not able to produce enough red blood cells on its own, so the Aranesp is going to help with that, and that's something that she receives every week dependent on her hemoglobin count. We get the lab results usually mid-morning here, and then based on that we decide if she needs to get the Aranesp this week or not. Sometimes she doesn't, but most of the time she does. I hope that this was helpful. Not every nephrotic syndrome patient has to receive weekly infusions like this. It is really just dependent on their severity of nephrotic syndrome and how their body responds to their daily medications that they take. About a year ago, we were having to come in 3 times a week to either the hospital downtown or an infusion center like this so that she could receive infusions because she was so swollen. She was having so many bad physical symptoms that we had to do a lot of infusions to really get that under control. Now it's been about a year and a half of doing these, and we're down to once a week getting infusions, which is amazing. Hopefully we can continue doing that for a while until we kind of figure out next steps. But yeah, hopefully that was insightful. Let me know if you guys have any questions. I know it's a lot, but I'm happy to help.